Clean, steam-sterilized instruments represent a global standard in patient safety. The ultimate aim is to effectively prevent the transmission of diseases caused by bacteria, fungi, viruses, or even the Creutzfeldt-Jakob disease via surgical instruments. For this reason, surgical instruments should primarily be processed in the Central Sterile Supply Department, CSSD, with a validated automatic process in a clean room environment. Manual processing is only permissible in exceptional cases and must be well trained according to written down standard operating procedures. In all cases, processing ends with the documented batch release of the sterile supplies and is completely traceable in the context of a quality management system. Patients and users presuppose hygienic safety and proper functioning of the processed instruments. Hygienic safety means the instrument is free of bacteria, pathogens, toxic residues, and carries a minimum number of particles. Patient safety is guaranteed by clean, steam-sterilized instruments. But how is the staff protected when handling used instruments? Standard operating procedures and action plans for occupational health and safety to protect the staff are written down. For example, the Infection Control Commission.
From the point of view of occupational health and safety, it is important that instruments are processed or disposed in a closed container immediately after use. Otherwise, the staff are at risk of being infected with blood-borne diseases by sharp injuries. Hepatitis C is the main threat here.
The hepatitis C virus is responsible for 50 to 76% of all cases of liver cancer. According to the WHO, an estimated 200 million people around the world, that is 3% of the world's population, are infected with hepatitis C. 3 to 4 million persons are newly infected each year. As a rule, avoid skin contact with instrument disinfectants. Please wear suitable protective clothing such as gloves, protective goggles, and a liquid-resistant apron. The desired quantity of cold water is added first. The water quantity must be measured as precisely as possible. Protective goggles must be worn during work with disinfectant concentrates or when placing contaminated instruments in the instrument bath. A suction tube doser is suitable for measuring out small amounts of concentrate. After the disinfectant concentrate has been added, the solution must be mixed well by gently raising and lowering the sieve insert. Please place the instruments into the solution gently without splashing. Hinged instruments need to be opened when they are placed in the solution. Please close the lid to prevent any odors from developing. This also prevents easily volatile active ingredients from evaporating and reducing the efficacy of the ready-to-use disinfectant solution. The exposure time starts when the last instrument has been placed in the solution. Due to the Creutzfeldt-Jakob problem, use non-protein binding aldehyde-free agents for steam sterilizable instruments. Follow the instructions for use regarding concentration and exposure time. It is easy to determine the required amount of concentrate from the dosage table. In the case of concentrations over 1%, remove a volume of water equivalent to the amount of concentrate that is to be added. Attention! Everything's going wrong here. Inexact dosing, amount not measured. Concentrate was added first instead of cold water. No protective clothing is being worn. After the exposure time has elapsed, the instruments are rinsed in the sieve insert under running tap water. Avoid recontaminating the instruments. Change your gloves and perform hygienic hand disinfection. A final rinse with fully demineralized water is ideal. This will avoid water stains and silicate residues. Due to the required low number of particles, instruments may only be dried with special lint-free towels. A paraffin oil-based lubricant effectively prevents fretting corrosion. Next, the instrument can be packaged and sterilized. The instrument cycle starts again. Correct instrument reprocessing protects patients and staff.